Now we are going into a branch of Ayurveda dealing with gynecology and obstetrics, that is dealt as Prashuti and Sriraga. Prashuti means, you might be knowing, it is regarding the pregnant care of pregnancy pregnant mother, and Sriroga related to the woman. Next, first we have to know what this deals with. That's gynecology, obstetrics. First we are dealing with the obstetrics. In the obstetrics, we are dealing with a pregnant mother. Before a woman goes to become pregnant, we should assess whether the body of the mother and both father are prepared, means they are healthy for begetting a kid or not. That we can assess by the qualities of their Shukra and Shonita, means the semen and the ova of the mother. Because if these two components which are going to beget a kid, fetus, if they are not pure, means if they have any impurities, the upcoming kid, it may have some psychological or some physical problems. So first we should know the properties of the qualities of the Shukra and Shonita. Shukra means the semen of the father. What the qualities the normal semen has to be, means the healthy semen. It should be spatikabam, means it is like transparent, and dravam, liquid, and snigdham, oily, and madhuram, we can't taste, but the acharyas has given these properties. It should be in a sweet consist and the order should be like madhu, honey in consistency and the order. And coming to Shonita, means the artava or the menstrual blood of the mother. This won't happen for the pregnancy, but still the menstrual blood indicates the health of the lady. And what are the qualities are? Sesa Ashruk. Sesa means rabbit. The Ashruk refers to the blood. The rabbit blood, in which color and consistency it is the same. If the quality of the menstrual fluid of the mother is there, then it is called as healthy. Means the mother is, lady is healthy. And Laksha Rasa. Lakka you might be knowing. Laksha Rasa Lakka. No? Hindi? Lac, LAC. Laksha Gruha, you might have heard of that. Yeah. It is reddish in color. What is the color of that? The menstrual flow should be of the same color, means the same in comparison to the color, and it's not staining to the cloth. These are the properties of the normal seminal fluid and the menstrual blood of both male and female. If they are normal, means that indicates they are healthy. They can get a healthy progeny. Next. Sukra, Sonita doshas. Shukra and Shonita, if they are not healthy, means they might be afflicted with some problem. What are the categories are? It may be due to Vata, it may be due to Pitta, it may be due to Kapha, and it may be Kunapa, some worm infestation, or some Grandhi, or Putiya, means it may have some bad odor, it may be less in quantity, it may be mixed with some fecal matter. All these are the abnormal forms of the Sukra and Shonita. If they have any problem like this, if they have any defects like this, they should be treated. First of all, before planning for pregnancy. Even though not planning, if they have any problem, it should be treated. Because Sukra is the seventh or the last dhatu. If all the previous dhatus are healthy, then Shukra dhatu, which is the last, it will be nourished and it will also be healthy. But if it is not healthy, that indicates the overall unhealthy status of the any male or female individuals. Yeah, Puti Puya means it is like putrid smell. Actually, we have a qualities. If it is afflicted by Vata, what are the qualities? What are the symptoms? That can't be detailed explained in this session because it takes lot of time, and we took 1.5 years to study all this. But please, at least you can understand that something is there. Okay. Next. Okay. Patya during Atavakala. Okay. Atavakala is the menstrual phase, and after that the fertile period of the female. You might have noticed many of our family generations, when a lady, if she is in menstrual phase, she is kept aside for few days till she is cleared with that. Otherwise, she is not allowed to do any work, she is not allowed to cook or do any work or physical stress, she is not allowed to take that. Because why? There is a scientific reason behind that. And this is the problem in modern generation. We are having many female patients who are having PCOS even at early age. They start menstruating and immediately we saw some hair on their face and some PCO complaints. This is all because of the modernization. We are not letting the female to take rest. At that time, it can be 3 to 5 days variation. It depends on every individual, their body. And in those days, they are previously our acharyas, they advised and it had been followed. The woman, she has to be taken rest. She is given at most complete rest and all the food, it is being given in her plate and she will just eat, take rest, no any work. Okay, because in that phase her body is going into lot of changes. She has to be in bleeding phase and she will be weak at that time. If you are not allowing her, okay, if you are not allowing the lady to take care of herself, if because of her job or whatever, if she is overstressed both physically and mentally, it can give lot of changes in her body which can have effect on the kids. Future generation have a lot of effect. That what will happen we will see in the next slides. And at that phase she is advised to have brahmacharya. Brahmacharya means no coitus. She is not supposed to unite with her husband. Because why? There is also in detail in Ayurveda why it is. If she is allowed to do that, so what will happen we will discuss later, but it's in short we can tell the if she is giving birth, the baby can have very less span or the husband will be affected with diseases and so on. And next, Havishana means rice prepared with ghee. She is advised to take that food. Even in the girl who is menstruating for the first time, she is kept aside and our forefather, and what the ladies do, she will be only given rice with processed with ghee, not any spicy food. Because if she has spicy food, she will develop more vata, and if she will do some activities, it will increase vata. If she will have some spicy food, it will increase her pitta, and it will have some overall bad effects on her health in the future also. Not even for kids, even she has to suffer a lot in her future. So the diet she has to follow, and the lifestyle she has to be taken rest. And Shira with Yavanna, and this is also a preparation processed with milk. Yava means barley. Barley is processed with milk. These are the diet advised for the girl or the lady who is in the menstrual phase. Next.
So no salt and spices?
No spices. No spices. Salt is little bit is okay, but not more. That is the problem with modernization, I have told you. Previously, girls are not going outside to study or do. They are at their home learning from their mothers how to behave with elders or the youngers or with some relatives, how to take care of the family, the kids. That much knowledge is enough actually. Yavanna means barley, milk processed with barley. Okay? If we are going to keep lot of stress in them, they will have lot of problems in future.
Reading is allowed?
Yes, she can read. Reading is not a problem. It is not some mental or physical stressing activity.
Excuse me. They say taking curds and milk during that period is not good.
Yeah, it's not good because her digestive power is also low and it can't get digested properly. Okay. And effects of ahara on progeny. What I told is if, okay, now this slide is about the pregnant lady. Sorry to skip because time is less, I have to skip on to the topics fast. And this is of the pregnant lady in particular, women in general and pregnant lady in particular. If a lady who is pregnant, if she is having more vata vardhaka ahara, means the food which increases her bodily movements vata, there is a chance that the fetus or the child can become kubja, andha, jada and vamana, means they have some impairments, dwarfism or dumb like that. Okay, and kubja means like shortened like that. If pitta vaddaka means more spicy foods, then it can cause pinga and kalita. Jada means they are numb, means they are not so active. Jada padartha you might have learned. Uh, autism, yeah. Okay. Yeah. Vamana means short height. And pitta vaddhaka ahara cause khalati and pinga means they have some issues related to hair, and pingaksha means copper colored eyes, something related to the hair or color. And kapha vaddhaka ahara causes svitra means vitiligo and pandu anemia. Why this is stressed is, if without the knowledge, if she is eating whatever she wants in whatever way she eats, okay, she might be okay, but it has a lot of effect on the progeny. Why we are planning? Because in Ayurveda, Garbhadana is a big chapter also. We have, before planning for pregnancy, we should understand that why we are doing that. Because we are humans, all animals, birds, they are also becoming pregnant, they are giving birth. Why we are different? Why are we studying all this? Because it's not a big problem for them. They will eat whatever they want, they will get kids, okay. But why this is, in Ayurveda, every corner is connected to the spirituality. Without spirituality, we can't understand anything in Ayurveda, even our science. Because why? Ayurveda, where it came from? First we will see the root. First of all, our purpose of life is to know the God. What we are and how are we connected to God. And to understand that we are all servants of God. Husband is serving wife, wife is serving husband. Like that we are serving each and everybody in society, family. But eternally we are always connected to God and we are His servants. To realize that, we should study Shastras, we should understand the God, what is God and His relation. That is the purpose of human life. If that purpose is missing, we are equal to animals. We are not better than animals. We are not civilized. In Ayurveda, the previous sages like Atreya Muni, Bharadwaj Muni, they were all felt compassion to the human beings, because at the time also people are getting sick. They are always suffering with diseases, and they thought, okay, what is the remedy for this? If they are always thinking of sickness, dealing with diseases, how to overcome this? Then when will they realize the God? So they went to the Svargaloka. They are having that much capacity to go Svargaloka. So they went there, they had a meeting with Indra, all the sages, and from there Indra passed this knowledge of Ayurveda from to the Rishis, and they divided these into different branches. Like Charaka Samhita, it deals mostly with the preparations, herbal medicines. Sushruta Samhita deals with surgical part. And Rasa Shastra, it deals with the herbo-mineral preparations. Like this, Ayurveda has come on to us human beings. So we have to understand. Without that, our purpose is lost. Okay? Shvitra means vitiligo and Pandu means anemia. And next, apatya on progeny. If previous slide we dealt with the food habits, now we see the lifestyle. What is it? If she is always sleeping, okay, but for pregnant ladies, day sleep is allowed to some minimum level. Okay, half an hour like that, because she feels disturbed in the night because of the growing baby. She may not sleep properly in the night, but in that case, she can have a nap in the morning. But if she goes on sleeping for hours together, the same quality is passed on to the child, and the child will be always like sleepy. Some kids we can see, they always interested in sleeping for more time, because something happened when they are in their mother womb, and that quality has passed on to them. Next, Anjana. If she is keeping Anjana, it is all Ayurvedic reference. I am just giving you whatever is there in the text. Anjana, then there is a chance the baby can develop the blindness. And Rodana, if she is always crying, then the child can develop Vikruta Drishti, means the impairment in the vision. In Ayurveda, a list is there, what is best. For Garbhini Stree, what is best is Prasanna, means she should always kept pleasant. Her atmosphere should be always pleasant. She should not have any disturbance. If she has any problem, we may not notice, but it will pass on to the kid. And today we are seeing some kids, they are more active, too much active, hyperactive. Because of the pregnancy, we didn't care of that. We didn't plan it. It just happened and it's going on, and she was eating like she is not following any rules described in Shastra, and we have to suffer later. We will see how kids are nowadays so arrogant. This is because we have to follow the Shastra. And Pradhavanat, if she is fast, running, more nowadays we can see a female, she is becoming pregnant and still she has to work. She has to catch train or bus or whatever vehicle, and she has to go and she has to work, take lot of stress. And because of that, Chanchala means the baby who is born, they become restless. They can't stay at one place. They won't listen to you. You say something and they will just run away. This all happens. And Ati Sabda Shravanat, if she is hearing very loud noises, then there is a chance the baby can develop Badhira, means deaf. And Ati Khadana means talking, more talking. So the baby will also have the same thing. He will be always talking. These are all the light, very minute descriptions. If you want to detail, you can go through other next sessions.
Anjana mean?
Kajal.
So these has to be followed even during menstruation?
Yes. Yes.
So how it is related if they can listen more sounds, they can become deaf?
It will affect their auditory systems.
Oh, mother is listening to more.
Mother is listening more. She can listen to light music, that is okay. If she is like much more than audible capacity, then it will happen. Okay. Next, Putrotpadana Purva Karma. In Ayurveda, and nowadays also you might be hearing this word, Garbhadhana Samskar. What it means actually? Garbha Adhan means a father is like giving a seed into the mother, and that is a samskar. It's not just some activity that they are enjoying. It is a spiritual path. Yesterday Prabhuji has already told Srinivas Prabhu that when a couple they got married, immediately they are not sent into some room and they are not allowed. Previously it was they are checking the muhurta. It is having lot of importance, and in that muhurta they are allowed to be single with each other, because this is a planning. Even in Garbhadhana, you should have a planning, because everything is planned. If you want something best, you will plan before. If you want to go somewhere, you will plan before. You have to make arrangements, you have to make tickets, everything. But if it is our kid, why are we not planning that? This is the problem with us. Now even the foreigners, they are coming to India and they are learning this and they are following that, and they are developing, growing their kids in a very great way. We the Indians, we are missing this point. This is what means, first, brahmacharya. Means before you are planning for pregnancy, you have to follow brahmacharya for 1 month. This is a minimum. Why this is, first, the female and the male bodies, they should be prepared for that process, both physically, mentally and spiritually. They should be in a mood of, because even before the process in our families, they are allowed to do some puja. Okay, they will get blessings from their elders. Everybody knows that, right? Why this is means they are praying to the God, divinity, that please bless us. Even to the elders they are asking, please bless us so that we will get a good child who is useful for the society. Because if the baby is not so, what is the use of getting kids? You will be suffering for the whole life, and the baby is also suffering for the whole life. So we have to follow these rules. And then ahara. What is the ahara prescribed for both male and female? For males, that is the would be father, he has to take sarpi, snigdha, sarpi, kshira and sali anna. Means the food what he is taking should be more in sarpi means ghee, snigdha it should be oily, and processed or whatever foods they should be processed with milk and ghee. These preparations, sali anna, this is a kind of rice. the preparations he has to eat this, then it will increase his vigor so that he will get the right child. And coming to the female, they should take Taila Snigdha Taila Masha Ahara, means the females, they should take food preparations processed with oils, and Masha means urad dal. These are prescribed for them. Much more is there. These are just a brief thing. And next, Putra Santana. This is also dealt with Ayurveda. If you want to these are the chances, not exactly. Some people want a female child, some people desire for a male child. How to plan that? That is also dealt in Ayurveda. Okay, if they are uniting in an even day of the menstrual phase of a lady, means after that, there is a chance that they get a female baby, and on odd days is a male baby. And Putrika Santana. Putrika Santana is just odd days, okay. Putra means even days, Putrika is odd days.
The qualities of the child will be decided even in a specific even day if they do that.
Yes,
The
yes,
qualities
yes,
also.
yes. There is much more depth in this subject. Actually, we can take a 1 month course also on this Garbhadan Samskar. Nowadays, people are making money using this terminology Garbhadan Samskar. You can see on YouTube's. They are making it for some money purpose, but it's not just money purpose. It is having much more than that. Okay. I am stressing on these points. I can deal with any other topic on the Prasuti Strilok, because there are many diseases. We can deal that, but now I am dealing all these topics because now you will understand something from this, and you can guide or your relatives or friends or whoever in your family, and they can also understand the importance of this subject. Okay. If you have any doubts, please ask me. Next, Sadhyo Gruhita Garbha Lakshana and Garbhini Lakshana. Nowadays, we have a lot of scans. If some lady, she got missed period, she will have some urine test, pregnancy kit, and then doctor immediately tell her, you go to scan. In that scan, then they will tell, okay, you are pregnant. That is not a big thing. Scan itself is telling, you can also read that, you can also get that. But Ayurveda Acharyas, they just told, looking at the appearance, the symptoms, whether if she is pregnant. First, when the lady is pregnant, the first signs you can guess is Shrama. She feel low in weakness. She feel more weakness in her body. Many of the mothers, you might have noticed this. You can have the better session than me. You can give this better. Glani, they feel weak. And then Pipas, they feel more thirsty. And Sakti Sadhana, they feel weakness in their legs. Shukra Shonita Avabandha means no more fertilization after this. And then Yonis Puranam, they feel like sensations in their yoni region. And these are the immediate signs. When the egg is fertilized, when the fetus is formed, means embryo is formed, these are immediate signs. But when it is, you can say, everyone can say that she is Garbhini by what? Stanyo Krishna Mukata means their areola or blackish in color, and they have some Romaraji hairs, and Amleshtada, they feel like eating more amla, sour food. You might have noticed this. And Chardi, morning sickness, they have vomitings in the morning, hate for good order. Sometimes they don't like good order also. Some ladies can might have already had this hate. And then Praseka, more salivation is there, and Sadhana, weakness. All these symptoms, when she is of at least 3rd to 4th month, then these symptoms start, they will observe these symptoms. And then Garbhodpadakara Bhavas. Okay. So, after she is pregnant, the fetus starts growing in the womb slowly, and it will develop the organs. Where from they are getting from? First, the bhavas from mother. What are the things the baby is getting from mother is all the soft organs like liver, spleen, heart, lungs. These are all the soft organs. The baby gets these organs from the mother. Means not directly, means the Matrija Bhava or the chromosomes related to mother, it will help in developing these organs. And bhavas from the father, what helps in develop are Kesha Smith, like strong things like hair, nails, bones and teeth, the veins, all these things they develop from taking the bhavas from the father. These are all from the father side. And then rasa means the food. What is the effect of the food is it determines the bala and varna, their strength and color. And bhavas from the atma. See, atma is also dealt in Ayurveda, means they are not missing the point of spirituality. Nobody in modern science tells that there is something like atma. Baby has atma. What it does is it helps in developing the indriya senses of the baby, and it determines the age, the lifespan also. All these bhavas come from the atma, and knowledge comes from the atma. These are the atmaja bhavas and satmya, and the whatever satmya means the habits of the mother. It decides the virya, arogya, bala, varna and meda. Intelligence of the baby, everything is decided from the mother, habits of the mother. If the mother is taking care of her, planning for pregnancy, even before that, prior to planning pregnancy and during pregnancy and even after pregnancy, if she is taking care of her diet, her habits, what she listens, what she speaks, how she feels, it all has effects on the baby. Everything. Because she is the baby is inside the mother for 9 months. The baby will understand each and everything what the mother feels, what she eats. If the mother eats spicy food, the baby will feel so much disturbed, because spicy, that is the reason spicy foods are not advised for the ladies. These are all the factors we have to keep a note of this. Smasru means mustache. Roma means hairs. Okay? Retas means semen from the father.
So mother, father and bhavas and rasa, like whose rasa is
Food.
the food taken by the
Food.
mother?
It is of the nourishing part. The nourishing part becomes the energy of the fetus. Satmya means the habits. Next. Masan Marsika Charya for Garbhini. Okay. See, if for the pregnant mother, diet is also prescribed in Ayurveda. In which month, what diet she has to take for the healthy development of the fetus. In first month, she is advised to have Madhura Sita Drava Ahara, sweet. Most of the ladies, they might not be knowing that they have passed this first month. After they miss the period, they will understand that, okay, now I am pregnant. After checking that she has a missed period, she will check through the pregnancy kit. But even before, we can understand if the pregnancy is planned. We can get to know that she is in the first month, because in these months, I have recently studied an article regarding this, that if the mother is having good food and good thoughts in her, it also affects the intelligence quotient of the baby. So you should be utmost careful in the pregnancy period, what she thinks, what she feels, what she eats, and what her surrounding environment is. Our family, everything should be very much supportive to the lady if at all you want a healthy and good baby. And next, in the 7th month, same as first month, 3rd month, same as first month, along with that Shashtika Odana milk. Shashtika means 60 days old, the rice is there, it is a type of rice, and that rice processed with milk. And in the 4th month, Paya, Navanita and Odana. Paya means milk, Navanita means butter, and then Odana means rice. This is the process. We have to process the foods in this way, and we have to give the pregnant lady in that month. And 5th month, Kshira and Sarpi. Mostly we will observe in our chart that, in a pregnancy, she has to get enough calcium. That will come from the milk, not just other milk, cow milk. And then Sarpi, ghee. Ghee is also helping in the development of the baby and also on the intelligence, brain activity of the baby. Because the better you take ghee, the more the intelligent baby will become. And then 6th month, Swadamshta Siddha Sarpi or Yavagu. Swadamshta means Gokshura. This Sarpi or Yavagu barley, they should be processed with this particular herb. It is not like daily, we have to at least administer on some regular intervals. 7th month, Pridhakpanni Siddha Swapi, it is also a different kind of herb and should be processed with ghee. 8th month, Astapana and Anuvasana Vasti, then Snigdha Vagu. Vasti is indicated in the 8th month because in the 8th month means they are going nearer to delivery. Because at that time they should have a freeness in their bladder and rectum. So to clear that, they advised Vasti, so that Vata should go in the downward direction. That helps in the free delivery of the mother. So at that time they advised Vasti and Snigdha Yavagu. And in the 9th month, Yoni Pichu, Snehavasti and Yoni Pichu, because this oiliness, this Yoni Pichu means the medicated something like Pichu, they will keep in the vagina of the mother, so that it will lubricate the lower area, the local area, and it will help in the normal delivery of the baby. Next slide. I think this is the Prasuti and Sriroga. Now we'll go for Balaroga, pediatrics. Next slide. Balaroga. Next. Kumarasya Bharanam Adhikritya Kritam Kaumara Bhrityam. Balaroga is detailed, explained in all the books of Ayurveda, and the particular book related to Balaroga is Kashyapa Samhita. Because every book has its own speciality in Ayurveda. You can't tell that this is everything. Every book has its own specialization. And what is Balaroga means? We are dealing with the kids and their diseases. Okay. Balasya, okay, you can forward to next slide. This is all the slokas. These are the different books related to Balaroga. The most familiar is the Kashyap Samhita. Other than that, we have Vriddha Kashyapa Samhita, Pravartaka Tantra, Bandhak Tantra. Most of the books are not available nowadays. Maybe the only book as of my knowledge, is Kashyapa Samhita. Nowadays, Hiranyaksha Tantra. Huh?
All books available in Sanskrit.
Sanskrit with the translation is there. English or Hindi translations are available.
All books are only there.
Not all books are available. Most of the books are lost. Nowadays, at present, available book is Kashyapa Samhita.
How you got this list, ma'am? The lost means?
It is already written in our books. Previous acharyas have recorded that these are the books related to this. But now presently available books are very few. Next, Samskaras. These are the processes we are doing. There are Shodasa Samskaras. Many might have heard this topic. Shodasa. Right from Garbhadan to the death. From birth to death, we follow, in our Indian culture particularly, these Samskaras are automatically followed. Till now. I don't know about tomorrow. At least till now they are following this. Garbhadan Samskar, some people are following nowadays because they had the awareness. Now people are following this. We have already dealt with. Next, Pumsavana Samskara. This is done when the mother is pregnant and she is giving some meditated processed herbs into the nostril of the mother. This is also being commercialized nowadays. People are doing this for a male baby like that, but it is not 100% chance. What is the reason behind this samskara is mainly to give the protection to the fetus for better growth of the baby. This Pumsavana Samskara is done not just for a male child or female child. It is aimed at the healthy baby. And next, Simanta Samskara, parting of the hair of the wife. When many of us might have heard this word, Simanta Naina, we are following this nowadays till previously also they are following. In the 7th or 9th month or so, the woman is done this with this samskara. Because why? If the woman is seeing all her relatives, everybody is coming to her, they are giving the blessings to the baby inside, she feels so happy. This parting of the hair, that is the samskara, but now they are not doing that. They are just coming, blessing, giving some gifts or something like that. Actually, this samskara,
It's done with that pot.
yeah, porcupine one, you know the porcupine? Quill, that, nail, not feather, that quill, mullapandi antar kada Telugulo, adi, yes, with that they will the husband has to do this. He has to part the hair of the his wife. Because why? He has to do this till the end. Because he is doing this to get the energy of from the mother earth. from the mother earth, we are giving energy to the mother so that she is going to be delivered in the few days or months, and with that she will develop that Chahana Sakti. She has to bear lot of pain at that time. If we are doing this, not only the woman is getting that energy, also she is happy, she is in good environment, looking at her friends, neighbors, everything, and this indirectly the baby will also be healthy, and she will have the normal delivery. Actually, God has given this gift to human beings and we are misusing that. That is the only thing. We are completing our lives just to save doctors. Next samskaras. Next samskara is a jatakarma or welcoming a soul. Previously, actually, women are not supposed to even get delivered at home. They are having a special place like called as Sutika Agara. Sutika Agara, the place for delivery of the mother. She has to enter that room when she starts pain, and at that place she will get delivered. Immediately after delivery of the baby, the father or the father mainly, he has to do the jatakarma, means there is a process called keeping a honey. Now also people are doing that, or dipped in gold in particular, because this will help in increasing the immunity of the baby to fight with the diseases. Now we are immediately giving the baby to the nurse, and what she will do, she will give the BCG vaccine.
There is also something called as Prasava Lehiam,
Yeah.
which is administered to the mother in Siddha medication. Another point here, the midwife plays a very important role.
Yes.
So it's always better to have a midwife to have this delivery process, transition smoothly.
Yes. Thank you. And then we have to, they are keeping that honey processed with some swarna or the gold. It is kept on the baby. Nowadays doctors won't allow that, but it is the actual immunity system. It is the actual vaccination according to Ayurveda. And furthermore, there is a vaccination in which month what to do. And one more process is called Swarna Prasha. It is nowadays they are doing that, and that we will detailedly discuss in later sessions. And then
What you said, what is kept on the baby?
they have to lick honey, not this much, very tiny quantity, very tiny, because they have not developed their digestive system.
Golden ring and
All golden ring, and they just keep on the tongue of the baby.
And Vasa Mataji, Vasa?
Vasa is also there, Prabhu. Prabhu, much more details are there, but I can't discuss now. Actually, there are much more herbs also. We will discuss in our 20-day session.
And Guru Chana?
That Prabhuji will take over later. And next is Namakarana Samskara. After the baby is born on the 21st day or so, they are giving the name. They are not immediately given the name. And this is also based on astrology. They will be given the name. And next, Nishkramana. First, coming out of the house. Nowadays, we are coming out of the babies coming out of the hospital. But it's not like that. Previously, they have to first come out of the house in the 4th month, when the baby is ready to face the outside environment. It is in the 4th month generally, and first they are taking to the temple, not some any other places. And then Annaprashan Samskara, first time feeding the baby, that you all know, and it is also having some scientific reason. At that time the baby will be crawling, and he is allowed to touch something like money or gold or some books. That will decide that what are his desires, indirectly telling you what he likes more, and you can understand that, and you can train your baby in that way. Okay, it's not like you will prepare first, okay, I will make my baby IIT like a doctor. It's not like that. And then Chudakarana, or this is a hair removal of the hair of the baby, first hair, birth hair. This is because they say that the hair, birth hair, has some previous lives sins in that, so we have to remove that. And then Karnaveda Samskara, or the ear puncturing. This is done for both male and female babies. People nowadays, they are thinking, oh, my baby will go in pain, I don't want to give that pain to my baby. It's not like that. You are not going to pain your baby. They will cry for a second or minute, or maybe maximum of 10 minutes. Why this samskara is given in Ayurveda is, it helps in developing the immunity. It is also having some marma points over ear. If you are puncturing that point at a particular time, it will develop the immunity system of the baby. Like.
Can you please repeat that sentence in Telugu? once the
This
same kind of.
కర్ణవేదన సంస్కార చెవులు కుట్టడం అంటారు కదా, ఆ చెవులు కుట్టడం అనేది జస్ట్ మనం ఫ్యాషన్ కోసం చేసేది కాదు. ఇట్ ఈస్ హ్యావింగ్ సైన్స్ ఇన్ దట్. ఇక్కడ కొన్ని మర్మ పాయింట్స్ ఉంటాయి, అవి మనం పంక్చర్ చేసినప్పుడు వాళ్ళలో ఇమ్యూనిటీ వస్తుందన్నమాట. ఇట్స్ అన్ ఇండైరెక్ట్ థింగ్ బట్ ఇట్ ఈస్ సైంటిఫిక్. Generally it is different from male and female baby also. For female baby it's like 5th or 7th month. For male baby it's like 6th or 8th month, like that. They do this samskara.
Ma'am, what is the position of kan within on ear?
This earlobe, in the middle of the earlobe. These are the previous, means just after birth in 1 year what are the samskaras, and after that pre-marriage samskaras. Before marriage what we have to do? This Vidyarambha, starting of education. At what time you will send your baby to your school?
5th year.
5th year. But now 2 years. 2 years. Preschool, nursery. Why? Because the mothers are not in a condition to take care of the baby. They want to take care of the duties outside. They want to learn to listen to their managers. They don't want to listen to their babies. This is the reason. And they are sent to the Gurukulas after 5th year or in the 5th year, because first 5 years is very crucial in development of the child, and it will decide all his life. That decides, first 5 years decides his life, what he is going to be and how he is going to help the society. If he has given lot of love and attention, he will reciprocate in his future. If he is not attending properly, you will be always watching your mobiles. Don't address your child's call. You will tell, okay, go and watch something, or you will give that mobile to the baby. You won't listen to him, then in the future he won't listen to you. So first 5 years very crucial in development of the child. Mother is the best teacher. Other than mother, nobody else can understand the baby's problem. Only mother can understand. If your first 5 years, if you are missing with your baby, you are missing your baby forever. And this is the main thing. And then Upanayana Samskara, or the thread ceremony, means after Gurukula, they will get educated under the Guru, and then they are given the thread ceremony, and after that is the holy bath signifying complete education. Means it is like certification, graduation, and after that the baby will decide whether he is going to get married or he will continue his brahmacharya. This is dealt as Varnashrama. Varna means what is he? Brahmana, Kshatriya, Vaishya, Shudra. Okay, we will keep that aside. Ashrama means Brahmana, Kshatriya, Vaishya, Gruhastha, Brahmachari, Gruhastha, Vanaprastha, Sannyasi. So up to this level he is in Brahmacharya. Means he is completely under education guided by a Guru. Then he will decide whether he has to continue that as a brahmachari for his lifetime, whether he can control his senses and he can deal with the subjects, preaching like that, or if he want to get married, he can go into the Gruhastha ashram, he will get married, have good progeny and help the society in that way. And after that, next samskara is Vanaprastha. Vanaprastha samskara is after 50 is Vanaprastha. Means you have to completely come out of your family burdens and completely focus yourself on the God, because your friends or your kids or neighbors, nobody is going to help you in your next birth. Only how you are and your relation with your God will help you develop and reach the God back. If you are not going through that, if you are still, nowadays even my father, what all people are doing after their retirement, they will first of all they will search, open the door, newspaper came or not, take it, read it, and then they have some coffee and then just start opening news channels one after other. They are not in a condition to listen what God is.
Next thing is trend is now they will start calling, that children. Idhar hai?
What are you doing? Where are you?
Working there, some are starting working again.
Again, yeah, even our professors, they got retired and now they are again getting admission to the colleges.
The trend has changed now. The retired persons are now looking out for jobs.
Yes, that's what I am saying now. They are again searching for the job. Means again they are into their youth? No. Against the nature. This we have to educate to our family and friends. That is the reason I am going out of the topic and stressing all these points, because you don't, there are in Ayurveda like Balarogas, everything is dealt. Like there are 20 types of diseases related to the menstrual phase in the woman and all that. If I am telling all that today, you may not be understanding what it is. But why it is, we have to understand first. And then you can understand what are the diseases and how to deal with this.
In Ayurveda says, Ayu Kamaya Manena Dharmartha Sukha Sadhana. You know, Ayu Kamaya Manena Dharmartha Sukha Sadhana.
Next slide, next slide.
So, Dharma Artha Sukha Sadhana for Ayurveda.
And next, Vanaprastha and then Sannyas.
For females also Vanaprastha.
Females should be always protected. Females,
Vanaprastha, they can accompany their husband.
yes, they can accompany like Gandhari.
Sannyasa, we have
Yeah.
100% blood. Never. But nothing but there is
Females are like that, they always think of their babies, children. Oh, my son, what he is doing, what his son is doing. At least males have some renunciation, but females, it is difficult to have that. That's why mostly it is prescribed for males. If the wife can accompany her husband and they both can do, it is the best. Like you can see the example in our Mahabharata, what Gandhari did with the same thing. And then sannyas ashram, and after that is the antyeshti, the end. And then these are the balagrahas. These are like these are the diseases related to the newborns. Like Skandagraha. One more slide is there, Prabhuji. One more slide. One more topic is related to kids is the balagrahas. There are many types, but we can't do that in detail, because sometimes you might be noticing kids, they will start crying suddenly, maybe in the nights. We don't know what happened with them. They can't express and we don't understand. Mainly the reason is they have some superhuman something affection on them, like some grahas like that, and they might be crying due to that, because kids are more sensitive. They can, some say that they can see some something like supernatural things like that, and they get feared, and out of that and they will start crying. I am not into detail and into that, but you can see that in Krishna's story, when Krishna is having a fight with Rakshasas, what Mother Yashoda was doing? She is applying cow dung to him for protection, and she is cow's tail, she is rotating around the Krishna. All this is to protect the baby from all these harmful effects. Now we are away from cows, we are away from nature. That is different. I think this is the end.
in Telangana, both mothers are giving that, what is called?
Hey, Jada.
They are giving, no, I am seeing that. But now in Telangana people, so many
This ends the topic of any questions?
Skandagraha, you explained that.
Skandagraha, that is having modern correlation, but it is very difficult. It's a deep subject, so I am skipping that. In brief, okay. There are names like Skandagraha, Skanda Apasmara, Nimesha. Apasmara relates to epilepsy, infantile epilepsy. You can correlate that with modern terminology. Negamesha Graha, Shakuni Graha, Revati Graha, Sushka Revati Graha, Putana Graha, named after the demon Putana. And it is called as paralytic ileus, means they have some problem related to their digestive system. And Sita Putana, Andha Putana, Swagraha and Pitragraha. These are all connected to the diseases of the baby, but they have some remedies in Ayurveda, not just with some herbs, it is having also some other than herbs. Means Adravya Bhuta Chikitsa, as we told. Impetigo, sorry, I can't tell you in detail with that, but these are all very deep subjects. Okay, just you have familiarity with that. Something is there related to the grahas in babies. These are not the real, they just get afflicted sometimes. It's not like they will get afflicted all the time. May some happen sometimes. Like some micro, in modern, they will tell that some microbiological, some grahas means what you say in Telugu? Bhuta, Bhutalu, something like that. Means we can't explain them in terminology, but they have symptoms like vomiting, crying, diarrhea, fever. We can't express that in detail, but this is just some modern comparison. Yes, yes. Balarishtalu. Yeah. Now you got it.
Mataji, impetigo is the bacterial infection.
Infections related to skin. Yeah.
And this is happening with him always, Shakuni Graha.
That can be due to some worm infestation also.
That I do in 3 months.
In some vitamin deficiency, that we have to consult the doctor.
What is the parental diarrhea?
Parenteral diarrhea. That is the normal diarrhea, and just they gave the terminology like that. Huh? Yes. Parent, not parent. Parenteral. Enteric refers to the gastrointestinal tract. Enough? I think there are much more topics to discuss. If we'll end here, we can go to another topic.
మరిన్ని అప్డేట్స్ కోసం ఎస్టీవీ యూట్యూబ్ ఛానల్ని సబ్స్క్రైబ్ చేసుకోండి.